Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check us out at sptwithme.com for our prep courses. Now, onto what you're actually here for. Let's talk about cranial nerve number 6, abducens nerve. This image shows an anterior to posterior view. And here you can see that the abducens nerve exits ventrally at the pontomedullary junction. Pontomedullary, pons medulla. This is an image that takes out the rest of the clutter of information and hopefully makes seeing where this nerve exits a tiny bit easier at least. This is a posterior to anterior view, same structure, thalamus, brainstem. So we're looking at the back side. You can see where the nucleus of the abducens is with respect to how high or how low it is within the pons. Now, of course, with this particular view, you cannot see how deep into the pons it is. So you're going to have to see a different view for that. This is what I'm talking about. This is a top-down view of the pons, so a transverse cut. So you can see how deep into the pons the abducens nucleus is. You can see it's towards the posterior aspect of the pons, but it's not literally at the very edge of it. So it's very important to be able to see images that display different points of view because all these images are two-dimensional. You cannot see that three-dimensional orientation of where everything is. Here's a lateral view of the thalamus brainstem, same structure. Here you can see how the abducens nerve travels ventrally. This is a good image to tie the pathway together a little bit. You can see that the nucleus starts, as we saw, the posterior aspect of the pons. Then it's going to make its way ventrally to the pontomedullary junction, where the pons and the medulla meet. It's going to exit the brainstem here. Then eventually it makes its way through the skull, through the superior orbital fissure, to reach its final destination, which is the lateral rectus muscle of the eyes, one eye each. This nerve is purely motor. It innervates the lateral rectus muscle of the eye, lateral meaning that it abducts the eye. So it makes the right eye look right and the left eye look left. It does not make the right eye look left or the left eye look right, because these two actions would be medial movements of the eye. That would be a deduction. This is a abduction. So testing whether or not this nerve works, all you have to do is ask your patient to abduct each eye. Now, obviously one eye at a time, although it would be pretty cool and interesting to have your patient abduct both eyes at the same time. Now on here I said H test because this definitely can be done as a component of the H test. So you have your patient sitting, you have their head still, and they're just focusing on either a pen that you're holding or your fingertip and you're moving it in the movement of a letter H. And when they get to that abduction part, you kind of just note whether or not they can do it or not. Hopefully this made studying the abducens nerve a little bit more easy. When you're studying for the NPTE, check us out at sptwithme.com. Here are the references that I used. Check them out if you want more info.